Serendipity. Well, my professional life started with a huge deception. I messed up my final school exam. Not a real fail, but enough to get not to get into medical studies in Germany. That was my plan. I looked into alternatives, decided to go to France, learn French, do my medical studies there. Then I moved down Europe. I'm here in Barcelona now, and into the world. That was a real setback or a mishap. But mishaps are the building blocks of successes, as we have seen in the tech talk. It was the best that could have happened to me. It opened up my mind, and yes, I would probably not be here today without that mishap. Setbacks can foster new ideas and development. It can be the basis for innovation, and it left me with the philosophy that everything is possible. Healthcare is full of serendipitous discoveries. We have just seen that. Sometimes someone finds what one is not looking for. This was the comment actually by Alexander Fleming when he in 1938 discovered the world's first antibiotic, penicillin. He returned from holidays and he found that a petri dish with Staphylococcus bacteria was contaminated by a mold. And that mold prevented the bacteria from growing. Another, 1938, 32-year-old Albert Hofmann synthesizes a chemical compound in the search for stimulating respiratory and circulatory systems. And then when he, in 1943, did a self-application, he discovered the psychedelic effects of LSD. It was then used in medical treatment and for particular mental care. It used by the CIA for interrogation. And then it has been emblematic, as we know, of the counterculture and the hippie movement in the 60s. Was then banned as an illegal drug. Now we have psilocybin and other compounds being rediscovered for treating severe depression. Another, just after the war in Bandura, Australia, John Cade used lithium as a solvent for experimenting with guinea pigs. He realized the guinea pigs were much calmer with that. This was the onset of discovering lithium as a powerful treatment for bipolar disorder, what he published then in 1948. 1989, we have seen that. British scientists Peter Dunn and Albert Wood created a drug for treating high blood pressure and heart problems. They never expected it to induce erections in the man that participated in the trial, hence the discovery of Viagra. Very much more recently, the mRNA research done over the last 20 years has aimed at looking for new cancer treatments. It came in very handy in 2020 when we discovered that we could reorient that research to look for quick development of a powerful anti-vaccine COVID vaccine. The COVID epidemic has been a driver for serendipitous innovation. Let's look into that. Before doing that, I'd like to see the big impact, the severe impact the COVID pandemic had, and we all have lived through that. It has a severe impact on morbidity and mortality. 6 million deaths. The dashboard, the COVID-19 dashboard, actually has accompanied that over the last years. It has been discontinued only 2 months ago. We have been seeing in the last 2 years the first decrease in global life expectancy in a century. Also, COVID had a big impact of equity, particularly the low income ranges, the poorest 2 billion people. Also, the impact on the workforce. who so greatly and heroically fought epidemic. We all remember this picture of the young Italian nurse that kind of break down from the work on COVID. We have seen then a lot of burnouts. We have seen with the workforce. We have seen mental problems, absenteeism, looking now into shortfalls in the workforce. Currently, a growing problem. And then the case of long COVID seems to be a systemic inflammation, but with very different expressions, but we don't really understand that. Hence, it's very difficult to treat. Necessary public health measures have produced an increase in conspiracy-minded anti-maskers and anti-vaxxers, which together with the disinformation that we have witnessed, induced anti-democratic right-wing movements in Europe and beyond. Another impact of COVID is like sharing information was very important at that time. We wanted to discover quickly what works, what doesn't. But these preprints that we have seen were not really following the usual check and balances that we know from the peer review process in science. Hence, we have seen a lot of people taking advantage in making up data. One example in point is the Certifer scandal, which actually led to a retraction of a Lancet and New England Journal of Medicine article. So we have seen a lot of downside, of mishaps, of setbacks with the COVID. But COVID did one thing. It really showed us the shortcomings of healthcare system. And by doing so, created a great opportunity for serendipitous innovation. Yes, COVID was a great driver for serendipitous innovation. When the world stood still at the onset of COVID, healthcare needed still to be provided, or even more so to be provided. We were seeing lacking respiratories to be produced by 3D printing here in Barcelona and elsewhere. A new registry of ICU beds was created in Germany. We looked at other industries, and it was the ticket seller Eventim that organized the vaccine registration in a northern German town. Telemedicine made a huge rise. No? The technology has been known, has been a well-developed technology, but was failing to really be introduced due to the challenges and also resistances that we see in health system. During COVID, it needed to be done. It was the only way to provide treatment for patients. Now telemedicine starts to enter into the day-to-day treatment and is meant to stay there. Vaccine development, already mentioned earlier, usually is the stepchild of innovation. Here it got enormous fundings, and we had shown that we could shorten the long development cycles, and we learned how we can accelerate innovation and regulatory processes. Actually, speaking with some people from the pharma industry, the pharma companies were surprised that the regulatory agencies were really serious in accelerating. So they were taken by surprise and really matching up with the speed, while they were complaining always before. Hospitals have learned a lot in the crisis. Hospital here in Barcelona, the Vall d'Hebron Hospital, adapted by creating acute care teams, physicians and nurses that were arranged around meeting real patient needs. They adapted space, they adapted the infrastructure, they adapted equipment, all this in order to make to be able to provide more care, moving towards a more flexible hospital. Usually hospital flexibility does not really go together. They started also to closely work with the ecosystem, with the different primary care centers, even with private clinics being in a public system here in STEAM. All this in order to be able to bring the care to the patient that actually needed that. Hospital Clinic Barcelona started to move towards one-day surgery. This implies an important change in processes and way of doing things. All this was possible because we had this urgency. It needed to be done. It's now we have to we have to do it. The World Health Organization and others has actually started to see how can we learn from all these different experiences and share them across health systems and healthcare institutions. And yes, health systems do need a lot of innovations. We have, and we know that, very poorly designed system, or even not designed at all. They have historically grown, and they don't have a good integration. They're not well integrated. They have the wrong incentives, and they have a very high cost of care. Medical errors are happening where basic rules of clinical guidelines are not being followed, or they don't even exist. Personal shortages, burnout, exacerbated, as we have seen by the COVID crisis, lack of motivation in current working conditions. Lack of data, lack of transparency. No wonder that we don't have health systems that do respond to patients' needs. And then also lack of education, also managerial education, skills in order to modernize and improve health system. We do have digital transformation and technology. We have AI, but this great potential is not yet being fully realized. We talk about value-based healthcare, but it's far from really being introduced. We need to redesign healthcare system around value in order to reach the triple aim the WHO had identified of creating better health, better patient experiences, and this with the best possible use of resources. Very difficult, as said Mark Persson, the head of OECD Health. Healthcare systems in Europe are designed for the 1950s. They are oriented around acute care, and even medical education is for providing hospital-based care. Payment systems are focused on specific intervention. And even biomedical research is based on the assumption that people have a single disease and not multimorbidity, as is the case. For him, success can only be found by overcoming, moving on from acute care to value-based healthcare. And we do see value-based healthcare happening already in different settings. Also in the United States, the investment, like financial investment in value-based healthcare has quadrupled during the pandemic. And that compared to investment in the legacy care and hospital infrastructure that stayed flat. Private capital inflows in value-based care rose from 6% to 30%. So we see that there's a lot of interest in changing healthcare, in being more dynamic in providing healthcare. So value-based healthcare on one side as a solution. AI, artificial intelligence, will change healthcare. We all heard about the ChatGPT. There is now a doc GTP that is existing. Both AI and value-based healthcare are very promising development. There's more reason for hope. Great innovations are actually coming from the global south, global healthcare, where innovations have to overcome specific challenges in infrastructure, in logistics. This is particularly in telehealth, the example of a telehealth company, eSanté, from Burkina Faso. We see great role models in healthcare. I brought here the example of Faith Mugai. She is a leading executive in Kenya. She told me that when she was learning and working in the United States, I had 3 things wrong. I was a nurse, I was African, and I was a woman. So this was what I had wrote. Now she's a leading executive in healthcare. Let me say one word on women. I think we women can make a huge difference in healthcare. Women, usually healthcare is delivered by women, led by men. We have started to have very good examples of women leading with a different mindset, and faith is definitely one of those. So yes, there's hope, and there's hope also here in Barcelona, where health innovation really start to take up. No, there are a lot of startups and ideas driven by enthusiastic young professional and multidisciplinary teams, often reorganized around the leading hospitals. What he mentioned too, the other one is definitely the Hospital Central de Lille, a leading pediatric innovation worldwide. Another is Teladoc. Teladoc put their international headquarters, the leading telemedicine company, have their international headquarters here in Barcelona. AstraZeneca is opening an innovation hub, etc. And we heard here about neurosurgery also to be really at the state of the art. This is the type of system that we need in order to drive serendipitous innovation. Serendipity is part of the solution. COVID has taught us that serendipity can be a great driver for innovation towards better systems and outcome. It's important to create the context. We had the examples from Barcelona, to have the context that fosters serendipity. If you don't start the experiment, you will never discover anything. If you don't buy the lottery thing, you will never win in the lottery. And we here as managers are needed for creating the right conditions for innovations to take place. This is the nice picture of the mural by Philip Stanton, thanking everyone who has supported the COVID crisis. You can see it in the metro station, Guinardó in Barcelona. It's still, last time I saw it, still free of it has not been damaged. The COVID crisis, let's not get the COVID crisis go waste. Healthcare challenges can be overcome with open-minded, fostering new breakthrough research. Yes, we can do it. The urgency of COVID has shown us. Create opportunities for serendipitous encounters, adopting a serendipitous mindset. It's time to work together. We managers, entrepreneurs, leaders have a critical role to play here with openness, creativity and serendipity. Erwartet alles, auch das Gute. Thank you.